ये देखने की ज़रूरत है अंदर क्या हो रहा है. That inner work is really important,
Reflect on.
which will push, support, bounce back, and add volumes to your outer work and vision.
पर आपने सोशल मीडिया की बात करी. You talked about social media and how is it impacting the youth, the mental health of the youth. But thanks to channels like yourself and others जो इतना अच्छा काम कर रहे हैं to aware people about mental health. But there is a different problem that is shaping, which is too much awareness, right? और उस too much awareness की वजह से क्या हो रहा है? The people who shape narratives, people who are in positions of power, they are capitalizing on it. The issue of mental health, they are capitalizing on the issue, or they are taking advantage of the people who are actually going through these issues. Example, like problems of fake doctors producing fake certificates, फिर you know false prescription of medicines, या फिर false diagnosis extensively. तो एक तो मेरे पास मेंटल हेल्थ, मेरे एंजाइटी इश्यूज हैं. फॉर एग्जांपल एक एक्सट्रीम स्पेक्ट्रम, इफ आई एम समवन हु इज डायग्नोस्ड विद डिप्रेशन, फिर वो रिलायबिलिटी, वो trust, when I see these things happening around me, how do you think I should proceed? What are the things I should keep in mind? Ki,
while thinking of reaching out for help and
For
whether
help,
that
yes.
okay, so yeah, very important again, very very important and imperative thing to discuss. See, one thing we have to take like a given, which is, of course, there are always players in every game, whether that is health, whether that is education, whether that is spirituality. In every area and in every era, there have been players, right? Somebody has to make a business out of it. I'm not denying on the fact that they're not giving their best in terms of the care that they have to provide, or the service that they have to provide. But of course, that making money also remains one major
integral
aspect,
part.
right? That's an integral part of it. So that is something that is a given. Now, when we are coming to mental health, narrowing down to this, of course, I'm still not doing anything as of now. I've just begun. And there are people who are doing really good job, and thank God that social media is there and people are getting at least aware when they were under that blanket of stigma and a taboo. So there's always good and bad of everything. So let's take it with a pinch of salt. That okay, at least we are getting aware that something is happening to me or to anybody else or in society, in culture, in world, and this needs an attention, right? So let's take it in a positive way. That awareness is there at least. Now, how to reach for help? Because I said to somebody that I think there was a bite that mental health खराब करने को भी लोग बैठे हैं अगर खराब नहीं भी है तो. That's what you are trying to say, that marketing, that social media, that everybody comes up and says that ऐसे करें. Even now that there are apps also where people go and they try to analyze their own.
Abhi, if today
mental health.
randomly, if I go and ask people who is your best friend, I think they'll, most people will say Chat GPT, AI.
That's what. Still, I was next to.
Which make them vulnerable.
I was next to point a finger on that, but yeah, good that you said. Now there are, before that there are these designed apps, which of course driven by ChatGPT and AI only, but like organizations and websites and like mental health care providers have these apps designed under their brand, and you can just see where is your condition,
Right.
and then you have your chatbot and
Right.
chat gpt and AI, and you can just
It's so
I'm
horrifying.
feeling that next chat gpt is going to get depression. There was one article, little what there was one good article I came across, and I was laughing like anything. uh, and then I think that logarithm something they have to set where they'll be depressed. Chat GPT logarithm will be depressed and getting anxiety. अरे बाबा इतना पूछ रहे anxiety के बारे में. So how far is that valid to be done, especially when it comes to your mental health? As we when we began with this interaction, we said that certain things, which is like family, so that is a bond,
Mm.
is unavoidable when we come as animals. That's
Right.
innate in us, right?
Right.
This humanistic look, this humanism, this you sitting across me is something what what only will bring the best out of me, and that is something what I want innately as a human being.
Mm.
I may learn how to, kind of stay and live without it, but that's something I may learn just. But I need it, and this is a requirement which is nothing done by you or me. This is something what we are innately uh, programmed that way.
I think reliability is something people are really struggling with.
Now, that's what I'm coming to.
Hmm.
Now, when you have these apps, there's no human touch in that. Of course, that you have a question, 10 questions that you can fill. Of course, that it can give you more than a good analyzed answer based on their algorithms, more efficient than a human being may take. A psychologist may take 3 sessions, which is giving you in 3 minutes. But then, psychology and your human touch and your understanding, what you it's just a question answer based on certain mathematical derivations. You're mathematically seeing it. And emotions and psychology is nothing to do with maths here. Had it been maths, things would have been easy. Somebody who is mathematical will not fall into depression, right? Somebody who is emotional is going to be caught into this mostly, forgetting about burnout and other things. But that is something what we require. So when this comes, what you are saying, reliability, why I extended and explained over it is that you have, when somebody requires a help, I say it every time, that choose your therapist wisely. You have to give it a try in person. Nowadays, we can make it max that we can be available online. I don't know whether you have been through the website, even I have kept it, that we can have a video call or a
Right.
phone call, because this is something, it's on an urgent basis. Somebody cannot wait when there is a panic attack, because this is not something which is coming as cold, cough, or fever, right? This is something where your mind is digressed and it's cloudy, and you have physiological symptoms adding to it, and you quickly want to talk to somebody. And nowadays, okay, a therapist, right? So that help has to be instant. वो जब तक आएगा तब तक तो पता नहीं पैनिक अटैक में क्या कुछ होके नॉर्मलाइज भी हुआ होगा, आई डोंट नो व्हाट. So you have to be on a phone call all the time, or at least, now we are worlds apart and somebody is at work, and even if we take Delhi, you have to like travel 10 kilometers, 20 kilometers. It's okay. I'm at least available to you online. So this is the beauty of your technology. But you cannot say that I won't see you in person, or at least virtually in person, based on that I have these 10 questions I can fill, and there's a flush of information, and you start observing and diagnosing yourself, which I every time say that you can observe. That is what this social media is helping you to do. You're aware, so you can observe. But don't go to diagnosis. Let some professional do it. Let no app and AI do that for you. I am see I am naive. I've just begun. I have not even a modest experience in when I'm doing this mental health, you know, help or doing it passionately or trying to bring something. But my understanding as an individual says, I read an article day before yesterday, experienced psychologists and psychiatrists are also accepting and validating the use of these apps. I'm sorry, I'm saying that I am naive in this. I am just a beginner student like you. But my understanding says, as a human being, my age says, my understanding of this human touch, this emotional connection says, I on air, I I do not accept that. I do not accept that. And we can sometimes sit across,
Hmm.
and no matter you're saying that you have 100 operations and you have 1,000 algorithms working and this is tech savvy, and no, you're playing with someone's life moment. If something, even if a version changes in that and this person is not getting that help in that moment,
Shattered.
he is shattered.
Shattered.
He's
Yes.
completely shattered. How can you play with someone's life? Because this is again not cold. आपको fever है, आपको the symptom है, ऐसे ऐसे आप ये दवाई ले लीजिए. Even that's not, like professionally right.
Hmm.
So I'll always be honest and vocal about it. I'm saying that I'm a student in this. I have just begun, but if I am a patient, I'll never do that.
Hmm.
And then as a care provider, I'll never do that. Many people told me and suggested me that I should be keeping questionnaires. Okay, we also have kept some minimum questions, but I'm not telling them to fill it and then this logarithm will do some result.
Hmm.
No. So what we tried is we are giving 15 minutes exploratory session free. You understand me there?
Hmm. ताकि वो एक कनेक्ट बिल्ड हो पाए.
Connect the build ho na. So that's that, and there is a strong think tank who came up with 15 minutes. This was again not me, but I accepted. I said, that's beautiful.
Hmm.
Somebody, I look up to, my guru, my therapist, my father figure, my PhD guy, Dr. Navteej Singh Bass. I quote him everywhere. I mean, he's my go-to person.
Hmm.
So this was his idea, that why not to do this. I said that's wonderful, because I was also nervous, and I am always nervous when it comes to, because I'm not doing it for business or something.
Absolutely.
I have my passion into it.
I
Right?
can see that.
I have my life.
Hmm.
I'm giving my life literally as in life to it. So for me, I really will not even think of an exploitation. Business wise, I might be a poor business person,
Hmm.
but I can't do that. So I was talking to him and I was telling him how to do that, because sometimes at the end of the session, if they're not comfortable, I don't feel comfortable asking for fees.
Hmm.
You know, until and unless you don't have that human angle as a psychologist, I'm not sure what it means professionally, but if I have to, untie the label of professionalism, and if I have to see what am I catering to, and then I think I need to have a human angle first as a psychologist.
Hmm.
So we came up with this, that okay, one session free is something we cannot afford, and somebody doesn't take it seriously, we'll do like 15 sessions, 15 minutes free exploratory session. You understand me, I'll understand you, but there will be no text everything. And I'm sure going forward also, I think I will never entertain it in Mind Beat with Soleh, and I'll never suggest it. So that is what I elaborated it too much, because this was very valid for people and audiences to understand. Because you're getting aware, that's okay. Then you're observing that, oh my God, these 10 things what they are saying,
Hmm.
ये मेरे में सब कुछ है. तो आपने अपने आप को डायग्नोस करना शुरू कर
कर
दिया,
लिया।
और जब आप ऐप पे जाते हो वो डायग्नोसिस उस पर वैलिडेट करके स्टैम्प करके ऑथेंटिकेट करता है। आई एम नॉट श्योर 10 out of 5
Yes.
would not be even, they will be so heartbroken that they will not even reach to help. So what are you doing with them?
That can also be a cause to
That becomes a
mental health.
cause, and that becomes another triggering factor,
Right.
and that becomes another, you are not motivated enough, you are crashed down. Oh my god, 9 में से 10 symptom आ रहा है. Even I am getting goosebumps while saying that can happen to me as well.
Like recently I was reading an article जहाँ पे it said, मतलब ये यूनिसेफ का था डेटा, that 14% of Indian youth is depressed, and considering the population of the country, the number is huge.
Yes, and I'm sorry again to say this, and I'm not sorry for being me whenever I say anything, and I can be wrong, and that's okay. I don't think that those figures are also right. We are far more beyond than that, because we
course.
have not done the work and the homework for actually us to reflect and say that these are the figures. We have not done that job yet, at least in our country. So our country ko leke any figures, I'm always doubtful.
Very skeptical.
Yes, going forward, maybe 2 years, 3 years, if the work is done properly and we have the actual reports, I think we will be like World Health Organization has recently said 1 billion globally are mentally affected. So, as I said, Dr. Navtesh Bans and me, he was like, we are also 1 in 1 billion. Yeah, 1 in 1 billion. So everybody is affected nowadays. The level up to which you're affected, that differs. So we have to take it really, really like comfortably, that even you would be affected somewhere, even I am affected and traumatized somewhere, and it's okay, because we all are, and we can't deny that fact. Just that range will fluctuate, because we are all made up of emotions.
We are exposed.
We
to
are
the environment.
exposed. We have this, life happens to everybody. How can somebody say that I did not feel the need? Yes, you ignored it because of unawareness, or you ignored it because you had to, because of being so aware and stigmatized, and this taboo that you're reaching to help, and oh my god, you're mentally challenged. No, that is another spectrum when you're mentally challenged, and that's also okay.
पागलों के डॉक्टर के पास थोड़ी जाएंगे.
तो कोई बात नहीं है ना, कौन ही कहेगा कि पागल. See that taboo, right?
That taboo.
Yeah. So even if that is there, this is what medicine has done basically. This damage, I come from science completely.
Yes.
This is what medicine has done, this damage. That you have ideologically built up a bias, fed in a bias. That so medicine does what? With all due respect to them, they correlate and suspended their organ and medicine and pathogenicity, right? So you have, sorry, not, like somebody has cardiac arrest, and then there is a medicine. So you physically try to see, you are connecting two things. You need to have something in front of you to cater it.
Right.
Lung failure, kidney failure, brain tumor, lung cancer, right? So एक तरफ से pathogenicity है, and we expect that there are these things which is viral, it is cancerous, it's bacterial, it's fungal, and then you have a medicine to it. You forget that there is something like mental health which does not see any organ.
Right.
And when we talk about therapy and counseling, that's why people don't accept it, because they have that thing in their brain. डॉक्टर के पास जाना है तो कोई ऑर्गन आइडेंटिफाई करेगा, और फिर यहाँ से कोई दवाई देगा, एक पैथोजेनिसिटी डिक्लेयर होगी, और फिर डायग्नोसिस के बाद हम दवाई खा के बैठेंगे. Then you feel that you have done your good job, spent 1,000 or 500 bucks, getting 4 tablets, now I'm sorted. And in therapy you feel, क्या होगा, क्या करेगा, बात ही तो होगी. क्या होगा उससे? कोई दवाई तो है नहीं. That's why you rush to a psychiatrist or a physician, and they give you, of course, that they're doing their good job, but sometimes you need a therapy, and that is their job in the first place to say, no, we can start medications, but you should go to a therapist because we are not trained in that. Let's see, unless and until it's not clinical. And I know that they are doing their job, but most of the times, क्योंकि मुझे भी एक इंस्टेंट आराम चाहिए ना. मुझे वो दवाई, वो लिंक, वो मेरा एक लिंक बना है. 3 circles.
Right.
Organ, medicine, pathogenicity. And here you don't see the pathogenicity. आपको disease दिखता ही नहीं है.
Right.
And then you are not trained, you are
Visual
not
नहीं है ना.
educated. Nothing is visual. And brain and mind में तो जमीन और आसमान का फर्क है. ये समझाने में ही another podcast निकलेगा. So something what we have to understand, that range will differ. You are also affected somewhere and you have an experience. I'm also affected something and I have an experience. It will differ, but we all need it at one point or the other. And elders used to do it previously in a family, tight knit. Now when you started this, हम 17 साल 16 साल की उम्र में घर से बाहर निकलते हैं. We lose upon that bond because we don't have time. We have these additional pressures, life, career. And then, but we are innately, inclined to finding somebody, and we make connections. And if something has happened wrong there in the upbringing, you have another view of the world. Or if somebody says, मुझे I don't like you, तो वो जो ये सारी कहानी हमने अब तक decide की, that becomes such a big rejection factor that now, because instant हो गया,
Right.
picture perfect हो गया social media की वजह से, all of that, follower नहीं मिल रहा है, किसी ने rejection दे दिया है, कोई कह रहा है कि I am not okay and this is not working, and you start doubting yourself, you start getting depressed. Somebody does self-harming things. कोई बिल्कुल भी नहीं
Drug
कर
abuse
पाता
हो
है,
गया,
कोई
addiction.
बिल्कुल भी नहीं कर पाता है इसको handle because कहानी childhood में फंसी होती है शायद, and then they end their lives, or they displace themselves and get into addiction, another big thing to discuss. लेकिन ये सारी कहानी कहाँ से आ रही है? इन सारी चीज़ों से. और अब आप ऐप देखते हैं तो वहाँ आप और कंफ्यूज हो जाते हैं. And you miss on the human touch. So before we go to next, just one single answer there. Try to reach out in person, over a phone call, in a video call. Try to see your therapist. Try to see your counselor. If it works, good. If it doesn't, drop it. Go to next. But don't do this. At least I won't suggest it. So that's the answer to
मैं
that.
तो
How can
काफी thankfully, fortunately, I am in a good space for now, and I am not. I mean, I don't use social media, and
Good.
also
You're aware, I know.
and
You're
also-
ahead of your age.
no. uh, I have gone completely cold turkey on social media.
Good.
AI, ChatGPT. To be honest, I do use it, but I know where to stop it. That awareness I have.
So that
जब भी
means
बहुत ज्यादा हो जाता है पूरा एक दिन बंद
that
हो
means
जाता
what I was saying. You
That
know
healthy line-
healthy
है.
line.
Healthy line I
So
have
in place. Good.
in place. वो कहीं ना कहीं मेरे experiences, the people I listen to, the people I have surrounded myself with, क्योंकि वो क्वालिटी बहुत important होता है कि आप किसके अराउंड हो, किसकी बातें सुन रहे हो, माई अपब्रिंगिंग, ये चीज़ें बहुत इम्पोर्टेंट है, एंड आई थिंक आई एम प्रिविलेज्ड इन दैट सेंस. बट फॉलोइंग द प्रीवियस डिस्कशन वी वर हैविंग, जब भी किसी के साथ सपोज समवन वी आर इमोशनली वेरी कनेक्टेड टू, वी आर वेरी क्लोज टू, उसके साथ कुछ ऐसा हो जाता है, लेट्स से डिप्रेशन से डायग्नोसिस हो गया है, तो हाउ डू यू थिंक वी शुड डील विद इट? एंड फर्स्ट ऑफ ऑल, बिफोर हैंडलिंग दैट पर्सन,
How we
and
handle ourselves.
हाँ, handle to make peace with the fact कि ये हो गया है, बिकॉज अवेयरनेस तो है, जब अवेयरनेस होना एक एक बात है, बट जब वी हैव टू डील विद इट,
You're not in those shoes.
राइट, जब वी
I want to congratulate you for this question.
तो देन
It's the core of everything.
क्योंकि अगर डॉक्टर हम खुद के साथ वो पीस नहीं बना पा रहे हैं, वो एक्सेप्टेंस, वो एक्नॉलेजमेंट नहीं ला पा रहे खुद के साथ, तो हम क्या केयर गिविंग करेंगे उसको? और एज मतलब वो समवन हु नीड्स इट, वी शुड बी एबल टू एटलीस्ट वो एक्सपेक्टेशन है कि वो देना, मतलब शी इज समवन वेरी क्लोज टू मी, तो आई वुड वांट टू गिव इट टू हिम और हर। मेरा पार्टनर हो गया, मेरी फैमिली में कोई क्लोज हो गया, प्लीज एड्रेस इट डॉक्टर।
I'm not a doctor, first of all. I'm not a doctor. Totally not a doctor. I can be doctorate in something, but I'm not a doctor. This is beauty, Ayushman. This talks about volumes about you when you are asking me such deep seated
वापस
questions.
कॉम्प्लीमेंट,
नहीं,
मैम
this is-
कॉम्प्लीमेंट नहीं
This is
चाहिए
not compliment. This is, I have to appreciate what I can see. I am expecting that you will be putting really deep questions, but when that's an understanding I had about you. Okay, that's somewhere you get to know.
बट आई विल
when
बी
you're
ऑनेस्ट,
putting it-
एक भी क्वेश्चन मैंने चैट जीपीटी से नहीं टाइप
नहीं
किया
है
था,
ना, वही तो दिख रहा है।
प्रॉम्प्ट नहीं दिया था
वो
कि
तो
यार
दिख ही रहा है।
बताओ कल पॉडकास्ट है मैम के साथ, कुछ डीप क्वेश्चंस
the
बता
flow
दो,
shows that
आंसर
you don't need to explain
आंसर
it.
बता दो।
You are really so I have to appreciate that, and I have to congratulate you that you're really aware, and just it'll be preserved anyway, but you should be aware that you are, and then why not? Why should not I appreciate?
But
I am a divinely connected person, भाई मैं तो appreciate करूंगा ना
मैम इसका
उसकी।
बहुत चैलेंजेस है,
ये तो तारीफ उस खुदा की है ना
बाहर-
जिसने तुम्हें बनाया।
बाहर से चीजें कितना सुंदर लगता है, कितना सॉर्टेड लगता है, हर चीज का चैलेंजेस है।
So that's again unavoidable and inevitable. That adds to the beauty. That
Yes.
adds to the awareness, basically. That's why you're aware.
That's
why you're mature.
That's what makes me understand that okay chalo, I'm living.
That's amazing if that's the feeling and understanding, you know.
But
If
address
that's the reason you feel you're living, because other people have a contradictory thought to that. They feel life is something else other than this what's happening. Right? So when you're in some other world, assuming and presuming something else, you miss on the life that you are in actually.
Right.
Anyway, philosophical ho gaya. Let's come to the question. So
इतना फॉर्मली नहीं कि यार let's come to the question.
नहीं, I'm like
इतना फ्लो में।
If you're not pressed on time, see, I am not.
I have, देखिए मैं स्टूडेंट हूँ, मुझे क्या करना है, इसके बाद लाइब्रेरी जाना है।
देखो मैं स्टूडेंट हूँ नहीं, वही सबसे बड़ी वैल्यूएबल बात है कि you are student. I mean, so
I'm grateful for the conversation.
Equally and more. I'm like, I forgot if something else was on calendar.
I'm not saying just for the sake of saying it.
I know that.
But I'm genuinely grateful. But please go ahead.
Yeah, evenly, exactly.
Same.
So, when somebody is in that turmoil, right? It's honestly and 100% exactly, in all honesty, it's only him who knows what he's going through, because it's onto his skin. The irony of this trouble is that most of the times you can't even explain what's going on. As an individual who is suffering through it, that turmoil that somebody is going through it, really, it can't be. That's the only reason reaching to help becomes important, because at least professionally they've learned the subject and they're trained at least to understand that yes, this is something which would be anyway existing, like lack of motivation, unable to explain. Whether they have gone through the training themselves or not, per se, in life, that's another thing. At least they're trained as professionals. That's why it becomes important that don't try your hands on it beyond a point. Just make your loved one or the one you're concerned about to a professional help. This was something important to mention, that's why I mentioned. Now, this turmoil, what somebody is going through, can't be explained to his own self because this is something gradually that has built up, and somebody has clear frames to differentiate that तब मैं ऐसा नहीं था, अब मैं ऐसा क्यों हूँ, क्या हो रहा है. There's already a tussle going on with it. And now, when I'm not able to explain it to my own self, what's happening to me, and I sit down every day, morning, night, before I go to bed, every second of my life gets consumed in this thought. What's happening? How will I explain? And people are reacting to me. I believe surrounding needs a therapy. It's not this person per se who needs to be fixed, because you can't fix him in first place, first of all. And you're not supposed to fix him, right? The surrounding, the caregivers are, I'm sorry to say, somewhere the reason, somewhere they have the responsibility. So both of these things become important. If they are the reason, so they need to know and accept that we also need to take some understanding counseling, which we call as family therapy, so that this person is in place. Because then you will learn. I am giving my coping understanding of my coping mechanisms to you, so that you help your loved one to cope with it, because he or she is not in a state. Of course, that the counselor will do a good part with him or her, but you need to know as a care provider more. When I'm not available, you are the only help he has. And if you are somewhere the reason for that situation, that stage what your friend has or your loved one has reached to, you better have to accept it in the first place. And I also need an understanding of how to deal with it. What you are very valuably asking, and with authenticity and a sense of responsibility, I could see when you asked it, because that's very integral part of you. So you have to know how to bring that comfort and understanding, because this is something what I am trespassing through, and you have no idea what I am trespassing through. These are, like, if I have to say it physically, these are geographically two distant worlds. So who needs a therapy first? Not, again, this gets very, very stigmatized, and people take it very, very sensitively, that, oh my god, do we need a therapy? Do I need a therapy? But Baba, the therapy means you have to understand how to cope, because you are the first help, somewhere a reason, or by chance now a caregiver or provider. So you have to understand, because first conflict is with you. Not that now you're a reason for that, just because you are not able to understand, because you're not the reason. So you're also confused, and I am reacting at you that why are not you understanding? I can't do it. You're telling me get up in the morning, have breakfast. God damn it, I don't have the energy and motivation to do that. एक बार आपको patience होगा, the third time you will lose your patience, right? Because you don't know what I am going through. And I am unable to explain what am I going through. I know it's important, but I'm unable to do it. So you need a counseling as well. Not that you have to fix something in you. No. You have to understand how to deal with me, how to cater me, how to behave when I am not in place. Because this is not something which will happen in continuity. If it happens, and it does happen, that's a different stage, but it can happen suddenly also. It has intermittently, repeatedly. There is no periodically to it, but intermittently, suddenly, or anyway under a blanket of depression. So it will be gloomy, and demotivated. So you have to have the patience and understanding. That mechanism you can't have on your own. So that's why we believe that care provider has to first understand what's happening. That counseling is important. So far in my practice, again very modest and small, I'm still struggling with people to understand that please don't do this.
Particularly the caregivers.
Please don't do this to them. It is not that we are trying to fix you. It's something that your loved one is struggling. You're also struggling with that. We're just trying to, normalize and have an understanding of that struggle so that it becomes little comfortable. A father comes that his daughter needs a counselor. So there are many issues with this. And we have to come to a consensus and accept that it's okay, which is what I'm saying. Therapy to you doesn't mean you have done something. It doesn't mean you are somewhere wrong. And I'm saying on air, of course, the environment has been wrong, whatever that environment was. But that environment, whether that was parents, whether that was siblings, whether that was friends, whether that is spouse, whether that is relations, something has gone in the close environment wrong. So we have to accept it. You can't deny it. Because I am not this because of me only. It's never just me. It's we all. Because it's an ecosystem. It's a habitat that you grow into. And if something has gone wrong from my side, so what? I can correct it. So forget that the person who is aware that needs help or doesn't know and is been exposed to help, forget about that person. But other people have more of a violation with this. How come that denial? How come can I sit for a therapy when this person is undergoing something? Then I suggest that let this person be shifted to that environment where people can understand and have compassion to at least understand what's going on and have an acceptance that we need to learn certain things. And it is pretty normal. I'll extend 1 minute more on this. It's again pretty normal. Let's compare it. Let's compare it with those three circles: organ pathogenicity and this. Now, when somebody having the surgery comes back home and is trying to heal, right? What do we do as care providers? We are patient. We are patient, right? We have patience. We don't talk in a louder tone. We try to provide everything. We help when that person is
Bring
standing
everything
going
at
for.
her disposal.
So what's with the mental health? Same. It's just that you can't see a
Lifestyle
surgery
changes
done.
thoda.
No, I mean I'm just saying something else. It's not that something is spotted across. कोई सर्जरी नहीं हुआ है जो दिख रहा है, कोई ऑर्गन डैमेज नहीं दिख रहा है, यू कैंट सी इट फिजिकली, यू कैंट मेक दैट ट्रायंगल. तो आपको वहां पे दिक्कत हो रही है केयर प्रोवाइडर को कि मैं क्यों पेशेंस रखूं. इफ समबडी इज येलिंग एंड डिमोटिवेटेड, मैं क्यों, वहां तो कर रहे हो अगर वो सर्जरी करके आएगा,
Right.
तो यहाँ करने में क्या दिक्कत हो रही है. वहां भी तो डॉक्टर कहता है ना कि आप आराम से रहिएगा, थोड़ा इनको आराम से रखिएगा, मूवमेंट मत कराइएगा, इनको टेंशन वाली बात मत बोलो. वो आप ही को तो काउंसल कर रहा है. व्हाट्स दैट? दैट्स काउंसलिंग. सिमिलरली वी आर आल्सो डूइंग द सेम काउंसलिंग कि इनको टेंशन मत दे दीजिएगा, अंडरस्टैंड कर लीजिए, विल टेक सम टाइम, डोंट टेक his or her things seriously, don't internalize what is coming from this person because this person is not in place.
But do you think अगर वो केयर प्रोवाइडर वो काउंसलिंग ले भी लेता है, तो डू यू थिंक उस टेम्परामेंट को मतलब मेंटेन कर पाएगा? हाउ इफेक्टिव वुड इट बी?
See, what are we left with as an option? So bare minimum is, if you understand this, bare minimum.
So for example, if suppose 5 दिन मैंने बहुत I was in my best behavior, ठीक है, फिर एक दिन कुछ ऐसा बोल दिया कहीं पे, of course लोगों के
Because you're
लाइफ
also an
में
individual.
काफी चीजें हैं लाइफ में,
Yeah.
तो कभी और उसी चीज वो जो 5 दिन का जो टाइम है जो इन्वेस्ट किया है, आई जेन्युइनली होप कि वो मतलब वो मेरी वजह से अगर उनका कुछ हेल्प हो रहा है, सो आई एम वांटिंग टू डू इट। बट अगर वो एक इंसिडेंट 10 सेकंड का आर्ग्यूमेंट हो गया, कोई डिसएग्रीमेंट्स हो गए, कोई इमोशनल रिएक्शन हो गया
which are welcome, yeah,
विच जिसकी वजह से वो जो मतलब
trigger हो जाएगा,
हाँ, वो 5 दिन का जो टाइम है वो पूरा वेस्ट हो गया, फिर डू यू थिंक वो इफेक्टिव रहेगी, कंसिडरिंग वी आर ऑल ह्यूमंस एंड वी ऑल आर imperfect?
I mean, of course. See, that's all welcomed. That's all welcomed, and that will happen. It's not that you have to be as a care provider, and we expect it from you that you have to be 24/7 on toes, being patient and being like in place. And of course, you will also, of course, you're a human being, and things will happen, and you will be hurt, and we have all empathy, sympathy, and everything with you. But that's what I'm saying. When you are aware, so we are reducing that intensity which you
Right.
unintentionally
Mm.
would do because you're not aware. Now when you're having a little bit of understanding how you have to behave, so that 100% of intensity can come down to 50. And then we are again telling you, even if you have reacted at some point, don't think that the hard work has gone waste. Again, you have to build on that. You have to then count, you're the immediate counselor to that person that time. It's okay, I didn't mean it, because you are still in a better position compared to that person. That's why you are given a counseling to understand how to deal. So you will be told, again, you will give a phone call to me that I think I wasted and I'm not able to go forward with this because I'm losing on my patience. And oh my God, there's a sense of guilt also. How could I do it to him or her when you had told me not to react like that, but I lost on it? So I know as a therapist that this will happen because you're a human being. But I'm counseling you back so that you counsel her back. It's a chain. Because more than her, you need a support at that time. That's why your counseling is also important, not to fix you. Again, to not you to be touched by that sense of guilt and not you to be on toes that you have to be perfect. No, you're also a human being. But you will go and settle down that chaos which happened in the middle of it, saying that I'm sorry. See, when you're aware, your terminology will be different. You will be, when you're aware, you will say, see, I'm sorry. I didn't mean it. I know you're going through it. And I'm trying my best. That's something which will work magically with that person because that's what he wants. Now, when you're unaware, you will take that reaction as a reaction. You will give a reaction thinking that I'm giving my best. I mean, come on, how cannot she understand that? I'm being patient. And that reaction will come on the other side and you will leave. And you will think, I can't do it. And there'll be no comeback. That's what happens in life. That's the only difference you make when you're aware and you're not aware. You don't want to do a damage intentionally, but awareness helps you build it back. Flexible, that elasticity is something what comes when you have an understanding. That's the idea. And of course, you have an
Practically तो
all-time
मैम
help.
बहुत difficult है. We
Who
can talk
says
about
it
it, but
isn't?
practical.
See, who says it isn't? It is difficult.
बहुत difficult.
You know, you're saying it as somebody you're attached to, right? Now,
अच्छा
when
नहीं,
we
I
professionally, for
personally
example,
don't have any.
no, I'm saying that you're talking from the perspective that
Of
when somebody
someone?
is talking in the terms of being a care provider,
Yeah.
I'm talking to you being a therapist, right? I am telling you that many therapists, and most of the times we also, including me, also can feel and do feel that, oh my God, I mean, this has again come to that point after 3 sessions. It's a challenge for us every time. Now, why am I saying and why are we saying go to a therapist is something because you cannot have that patience. We are trained and this is our job to do it. So that's why that little bit will be given to you, but you have to bring that person to a professional who knows that he has to understand, analyze, at the same time be patient. That's the only difference. Because practically it's not possible with you as a care provider
But that can
or as
open,
somebody who's concerned.
और उसके लिए suppose someone that can open an opportunity for self discovery and someone can follow it as a passion,
Of course.
right?
Of course. I can see something developing here. Of course, because see,
हाँ
you evolve, you observe, and that's how you explore yourself. That's how that calling sometimes the other day we were talking. You start responding that, okay, was this? Can I give it a chance? And that's an exploration. And then it comes clearly in front of you. Like, oh my God, this is
personal
something I'm
experience
doing.
से now you're doing it professionally after a formal training.
You know, then you see when it speaks back to you, that's when you feel that's something what happened to me. When it spoke back to me, I felt, yeah, this is what I'm supposed to do.
और भी बातें करना है आपसे
अभी के लिए बस है ना.
अभी के लिए बस चलिए.
So this is beautifully, this has come up so beautifully because I think बातों बातों में शायद जो जरूरी था. Family therapies are important. A therapist is important. Counseling is okay. You don't need to be damaged, and you need a counseling at any time. And everybody needs it. Me, you, everyone. And life happens. And spirituality has
Family
some
के
role
बारे
to
में,
play. Family is
spirituality,
a core center. And why are we
social
flipping in
media.
social media? Gen Z का जो
Gen
एक
Z aspect.
idea.
Although we didn't talk much about it because आपके previous videos में already
Yeah.
वो चीजें आपने cover करी है.
Well researched, huh? You're sitting here and मैंने कोई prep नहीं किया.
I am a fan. I am a fan. Prep तो नहीं किया, but I am a fan. So I mean.
Fan of what?
Of your initiative.
Oh, no, I mean, no, don't say that you're a fan of my initiative. It's something that's anyway existing. And yeah.
But you are doing a wonderful job. और भी काफी
I'm
सारी बात
trying.
करना है आपसे.
हाँ जी,
मन नहीं
करेंगे.
कर रहा है कि
करेंगे. Definitely. And I'm sure that the other one would be even more interesting because I really like speaking and sharing and you know, very aware, in a very aware and in a very deep seated conversations have taken place.
वो तो वीडियो देखेंगे तभी पता चलेगा. चलिए.
चलो.
Some words of hope for me and our viewers. Conclusion तो ऐसे ही करते हैं ना.
Again I'm very modest.
Conclusion ऐसे ही करते हैं. कोट को मतलब जो कोट था जिससे इंट्रो करना था वो उसमें तो मैंने बर्बाद कर दिया.
No, nothing is like बर्बाद.
आप कंक्लूजन थोड़ा अच्छा दे दीजिए.
नहीं, this all has been beautiful. So no, let's not damage it by saying कि वो ऐसा वैसा हुआ है. So you said some hopeful words. I'll say just remain hopeful. That's the magic. It's the first thing. Keep that hope
alive.
It will anyway remain, but there will be factors, there will be experiences, there will be challenges which will try to dim that. But what I said in the beginning, that is the only thing somebody should not play with, and that's the only thing you should always stay with. Be hopeful, that does wonders. Be yourself, that's my tagline. Try to be yourself. If you can't afford being yourself all the time, whenever, wherever you can afford being yourself, be, and have a hope on that that it will work.
Thank you so much. आपकी मेहरबानी है.
मेरी तो मेहरबानी नहीं है. This is what I live by, and you asked for it. This is simplest I can say right now.
वीडियो देखूंगा. I'll try to reflect on them. Reflect on the words.
Yeah, it'll be a.
हो सकता है कि काफी चीजें जो आपने बोली है while communicating and conversing I have missed out. उसको I can see कि हाँ
That
उस पे I
happens.
can think.
That happens to
हाँ.
someone whom you think that okay, I have to extract an understanding from him. वो उनके साथ भी होता है.
हाँ.
I also will miss out on many things, or I can also feel अरे यहाँ पे ये भी एक valid point था and I missed it, because in that flow, that's the beauty of the flow. You know, it's not scripted, and you just flow with it, and
Right.
that's the beauty. So if something is missed is okay, but let's enjoy the flow.
हमने वीडियो रोका तो नहीं. फर्स्ट टाइम के लिए आई थिंक आई हैव
अपने आप वो रुक गया हो पता नहीं.
I was okay. So
So
thank you so much for
thank
the
you so
conversation.
much, and thank you to everyone who would be watching it tomorrow. Anytime, we must have done some mistakes, not deliberately, but of
I
course.
have done a mistake.
I
Some
said,
mistakes.
I said we, and that's we, right? There's no me in that. So we must have done some mistakes, and not intentionally, of course,
I
but
sincerely apologize for
that was not anyway a mistake. That's a part of it. That was not a mistake.
right.
So we may have, because it becomes difficult to cover each and everything and every aspect of it. So somewhere you may have related to it, somewhere somebody would say, no, that's not right, this is not my way. That happens, and that is acceptable. If something somebody has related to, really sorry about that. And if somewhere somebody has felt that no, this is not what I can relate to, that's exactly true, and it's okay, because we cannot cover everything and we may not be knowing everything, because we are both students of life.
चलिए.
Thank
Thank
you.
you so much.
Take care. God bless.